Medical technology use is continuing to increase throughout the United States and in developed countries. Recently, life expectancy in the U.S. has been continuing to increase as well. While analyzing the life expectancies across different demographics, we noticed that developed countries tend to have a higher life expectancy than countries in the process of developing. Developed countries have accessibility to medical technology advancements. The United States has a life expectancy of about 79 years, while South Africa has a life expectancy of about 57 years. South Africa doesn't have the access to the medical technologies the U.S. does, causing more lives to be lost.
Dr. Andrew J. Kirsch is a pediatric urologist from Atlanta, Georgia. He attended school for 16 years and has been practicing medicine for 20 years. Dr. Kirsch's areas of focus are urinary reflux and urinary tract obstruction surgeries. When asked how technology has improved his area of work, he replied,
"The area that I have focused a lot of my effort on over my career is both urinary reflux and urinary tract obstruction. The first diagnosis of reflux has become a minimally invasive type of treatment as opposed to previous years where the children were treated with a incision and hospitalization. Now there is a minimally invasive way of treating reflux as an outpatient without an incision, and this involves injecting a sugar substance called Deflux, and this is a 20-minute outpatient procedure that has a very high success rate.
Why do you like performing robotic surgery?
Robotic surgery is a major advance in that incisions are quite small. Robotic surgery allows you to do whatever you do with your wrists. So different movements allow you to do some of the more complicated reconstruction that we do with an open incision. So these patients do very well because they have small incisions and go home quicker.
When you have traveled to other countries, is the medical technology different than it is in America?
When you go to other countries, because of the expense involved with the product, a lot of countries don't have access to this. For example, in South America, if a family decided they wanted the reflux treated in a minimally invasive fashion, they're given a prescription to go and buy Deflux, and that may cost $1,000.
What advances in medical technology do you see happening in the future?
Technology hasn't moved quite as fast in the pediatric subspecialties. So what I envision happening in the future is that some of these instruments will be made smaller, so it allows us to operate on smaller children using smaller instruments and sutures.
Medical professional Dr. Andrew Kirsch states how medical technology makes his job easier and makes the patient's life longer. He is excited to see what medical technologies will be created and improved in the future. Because of this, our argument is supported.
Another source of evidence that proves that medical technology saves lives are specific patient cases. The picture shown is a baby who had an 80% chance of death before his first birthday. With the use of new medical technology, the doctors on his case used a 3D printer to practice the very intricate surgery. This next picture shows a girl with diabetes. She was thankfully able to get an artificial pancreas and was able to manage her disease a lot easier and safer. Without these advances in medical technology, none of these patients would still be living healthy lives today. Some people may say that too much money is being spent advancing technology in the medical field. Healthcare economists estimate that 40 to 50% of the annual cost increase is because of new inventions of technologies or innovations of existing ones. Some people say that the price of healthcare is on the rise and is spiraling out of control. Although advances in medicine can be expensive, saving lives is more important than the money spent.
To provide specific evidence for our argument, we created a survey to collect the thoughts of everyday people and their input on the advances in medical technology. This first question was free response. Most of the answers for this question consisted of people saying how much it improves patient care, helps hospitals to grow, helps to diagnose disease faster, along with reducing error in the medical field. Others also said advancing medical technology is beneficial, it saves lives, and how it's crucial to keep the human race more healthy and living longer. This next question concerning 3D printing quickly touches on how many people are aware of the medical technology currently going on in today's society. The results for this last survey question was a strong critical point in our evidence to support our argument. This shows that our society agrees with using the digital file system instead of paper system because it's much faster and more efficient when trying to access medical records.
Throughout this documentary, we highlighted the vast array of medical technology, all in which are beneficial to human health. This therefore supports our argument that advancing medical technology improves life expectancy.